Thanks, Julia. And hi, everyone. Welcome to our Learning Lab about SCANR, Resources and Guidance for Analysis of Secondary Data in Agriculture, Food Systems, Nutrition, and Health. I'll be co-leading this session with Will Masters, who will introduce himself in just a minute. I am a PhD candidate at the Tufts University Friedman School of Nutrition. And I do want to, again, encourage you all, if you have the bandwidth and you feel comfortable doing so, please turn on your camera. We hope this will be a really interactive session, and we're looking forward to getting to know you all. So Will, do you want to introduce yourself?
Yes, thanks very much, Elena, and to everybody for joining us. I want to start by saying that this is the 6th annual ANH Academy meeting, and this is the very first event of this year's edition. So I want to celebrate that and to note that this is the second one that's fully online. And I turned 60 years old this year. This was the most horrific year of my life. I think many of you have experienced really, really terrible challenges over the past year. We went online because we needed to escape from COVID. I want to start with, of course, sympathy and condolences to anyone who has lost a loved one, especially most recently in India, in South Asia generally, people in Brazil now. The US, of course, went through the worst of COVID some months ago, and all of us have seen our lives disrupted. But we've invented around it. We've renewed our ways of building community, and I want to thank everybody from the ANH Academy team making it possible for us to get together in this way. I think you'll see that Elena has crafted a program for these 2 hours where we will get to know one another. We will work together. We will see new things. We will be able to build a community of researchers in this learning lab who can truly discover through the kinds of data that we'll be able to access and the methods that we can learn together to make the world much more resilient in the future, much more capable of responding to things like the COVID crisis, like the massive continued undernutrition and the rising threat of diet-related diseases around the world. So to build this community, I want to start by saying, please rename your Zoom identity. So you see that I did that, to use the name you want to be called by. So I am William Masters. I am a professor at the Friedman School of Nutrition at Tufts. So a short way to refer to me is I'm Will Masters from Tufts. And each of you could put the country you're from or the institution and whatever name you would like to be called. We will be forming breakout rooms just like we were physically in a room all together, except that none of you had to travel. None of you had to get visas. Our carbon footprint is very, very low. It's not exactly zero, but it's almost zero. And this is part of the revolution. So welcome to the future. Welcome to the future where we can travel less and meet more often. So there are people on this call I have met with, talked with face-to-face more often, thanks to Zoom, thanks to the online community that we've built during the pandemic. And I've been able to do that with vastly less carbon footprint. So while each of you, I hope, is able to take refuge from COVID and refuge from climate change and refuge from many problems, and we can work together in a more effective way. So Elena will talk about how we'll actually work over the next 2 hours. I just want to talk about the motivation for this. So I was very fortunate to be part of the founding of the ANH Academy. The ANH Academy is, in some sense, the brainchild. Our grandfather is Jeff Wage, who had experienced working all across Asia, Africa, in agriculture, nutrition, health issues, and he had the idea to create this academy where people could come together from different disciplines and share ideas. And one of the big discoveries in that is that the explosion of online, of freely available public data that so many data collectors and data managers have a mandate from their funders to do. This is the open data revolution. You cannot get a grant from USAID or the Gates Foundation or UK Aid without a mandate to disclose that data publicly. As a result, we now have literally at our fingertips data from surveys conducted all the way back to the 1980s and in every country of the world on an extraordinary range of topics. And the SCANR resource has as its logo a very clever globe with a magnifying glass, an old-fashioned image of like the sleuth, the Sherlock Holmes type detective looking around the world with a magnifying glass, because we can literally travel the world and examine and understand through the lens of this SCANR website, the SCANR tool. So in the course of these next 2 hours, there'll be no PowerPoint, just each other and the internet. It's just us and the internet. That's it, no PowerPoint. And we need to talk to each other to get to learn how to use the internet better. And Elena will be our guide, and each of us will be each other's guides, as you'll see in the arrangement. So I see people are introducing themselves in the chat box. Thank you very much. Please keep doing that. I want to just close by saying, when I started doing research in the 1980s, late 1980s, I, like everyone else at that time, and everyone of my generation, had to collect my own data. I was very fortunate. I had funding to do 2 annual rounds of survey work. In other words, one whole harvest and then the next planting and harvest over 2 full years in a nationwide, the very first nationwide smallholder farm survey in Zimbabwe. This was 1988-89 harvest season, and then 1989-1990. And so I was able to travel the country, visit individual farmers, and work with enumerators. Zimbabwe happens to have, in a sense, only 2 main languages, but many countries would have many, many languages in which to conduct these surveys. And that was an extraordinary experience for me. Collecting my own data was a great, great personal learning journey, and especially to do it nationwide, a very diverse country, and in 2 successive years. There's a Shona proverb, the same year never comes again. I learned that because the second year was very different from the first. There's no substitute for shoe leather research, meaning just travel, walk, talk, meet, and thereby understand. But, and it's a big but, what I learned was just Zimbabwe. It was just those 2 years. When I look back on the questionnaire, I'm just like mortified because we asked nothing about diet. In 1988, 89, and 1990, everyone was concerned about productivity, just getting enough food on the table. That was urgent and it was necessary. And farms were a business. They were a route out of poverty. That was urgent, that was necessary, but clearly it's not enough. And now I work mostly with a sample of about 1.5 million people. I work mostly with the demographic and health surveys from the 1990s through to today, dozens of countries, and about 1.5 million mothers and their children. That's the main sample of research that I work with. I also work, of course, with many, many other kinds of data, and you can too. The opportunity to download primary data, that is to say the actual observations, primary in the sense of the micro data, the individual observations, whether that's observations for a country from FAO stat or the World Development Indicators, whether it's observations for an individual country every month, as you might get from an individual country's own databases of various kinds that we'll see, or individual households or individual people. What we will see is how to merge those data, how to use them to discover new things that you could never see on your own. That you could never see on your own because you only live at one place and one time, and that's not enough to understand this complicated world. You also, and I also, have only one education, only one personal trajectory through learning. And that gives us one point of view that is uniquely valuable. Uniquely valuable, of course, for you and the people you interact with directly, but also for your readers, for the audience globally, for the research that you do. So we want to hear from you as an individual, but each of us has to learn from each other because we all know things the others don't. I'm an economist. Economics knows a lot. Economics is a very old field. We are standing on the shoulders of giants. We have many, many hundreds of thousands of articles that have given us data analysis and data sets and so forth to merge. Others on this call are agronomists, veterinarians, nutritionists, public health researchers of all kinds. And so we have so much to learn from each other, so much to share, and so much to understand through this scanner lens, this image of a detective scanning the world in order to bring back data and make sense of it. So Elena will explain how we're going to do this. But thank you so much for joining. I'm really excited to have you all here. We have 101 participants, and it's a great community. This ANH Academy is, and this call, this particular learning lab, I think is enormously promising. Elena?
Great, thank you, Will. I think we'll benefit a lot today from Will's vast experience with data synthesis, and I'm also very pleased to see how many people have joined this session. I see some familiar names and a lot of new names, so I think we're going to learn a lot from each other today. So during this session, as Will said, we're going to talk about some of the origins and opportunities that come with existing data, and also a lot of your challenges and successes. So we're going to spend a good amount of today learning about your experiences using existing data, sharing your experiences with other people in the session, and kind of learning from each other. So you probably heard Will say the word scanner a few times, and you may not have been sure what he was talking about. So we have been working on developing a web tool that we call SCANR, S-C-A-N-R, or the Synthesis Center for Agriculture and Nutrition Research. That is an online hub that connects researchers with data and resources for analyzing existing data related to agriculture, food systems, nutrition, and health. So one of the key things we want to do today is introduce this tool to you, and also to get some of your feedback. So this has only been online for a few months, and we hope that it will be a dynamic tool that can be built out over time and respond to the needs of our community and kind of be built together. So we hope we can introduce this tool to you today, and also really hear what you think is great about it and what you think is not working so well. But first, as Will mentioned, we're hoping that even though we have a lot of people in a virtual room, we can still somewhat get to know each other today. So in a few minutes, we're going to launch into our first of 3 breakout rooms. And in each of the breakout sessions, you're going to be with the same group of people. So we hope that you can get to know them as if you're sitting right next to them, even though you probably didn't have to leave home this morning. And in this first session, we want you to meet your table and kind of get to know a little bit about the data landscape at your table. What data sets have you all worked with in the past? So when we send you out into the breakout rooms, we want everyone to introduce themselves, share your name, where you're living, what you do right now, and where you work, and then talk about the publicly available data sources that you've used in the past or you're currently using. And because we have a big group, we're going to ask everyone to report back in the Zoom chat box when we come back into the main room. So make sure you designate a note taker in your group that can keep a list of some of the data sources and reflections that you talk about. And before we launch you into the breakout rooms, we do want to remind you that we'll be sitting in the main room. So if you have any questions or thoughts during the breakout session, you can come back into the main room to talk to us and then go back to your breakout room, just like we were standing at the front of a big conference room. Okay, so Julia, I'm going to ask you to open the breakout rooms when you're ready, and you all will have about 10 minutes to get to know each other. So welcome back to the main room. I already see some great notes from breakout room 14. It sounds like you all have worked with a lot of different publicly available data sets. So we have things like the food balance sheets from FAO. When I popped into a few of the breakout sessions, I heard a lot of talk about the demographic and health surveys, and I see a few people in this group worked with some demographic and health surveys and some other types of health surveys. So as everyone comes back in from the breakout rooms, I encourage you to jump into the chat. If If you did designate a note taker, that person can report back in the chat box what data sets you talked about. But if not, feel free, anyone is welcome to write in the chat box to share. We'd like to kind of see what you all work on and which data sets you are using right now and have used in the past. All right, thanks, David. Again, I see some demographic and health surveys, the living standards measurement survey, and the food balance sheets. Those seem to be some big ones in our field. I also see a mention of the ARENA project, Advancing Research on Nutrition and Agriculture, which combined the demographic and health surveys with the GIS data set. So that's a relatively new one that is available for public use. I see Michael mentions he did a literature review of climate change and gaps in strategies for mitigating climate change. And let's see, we also have some weather and climate data and crop data. So it is good to see we have quite a bit of variety in this group. So I hope we can learn a lot. We also have people who've used time series data. So we have a lot of different types of data. Great, so keep it rolling. I'm seeing over and over, a lot of people have experience using different types of DHS, LSMS, and food balance sheets with a sprinkling of a lot of other types of data sets. So one of the key things that Will and I have been thinking about as we develop this SCANR tool is how to combine data from different sources and the key challenges and difficulties that come up when we try to do that, but also really, big opportunity that can come from putting together data from different sources and then synthesizing it to answer new research questions. So in the next part of this lab, we want to actually introduce you to this new web tool that we call SCANR. So feel free to keep discussing your data sets in the chat box. I'm also going to put the URL for the SCANR website in the chat box again. Or actually, Will, could you drop the URL in the chat box as we go?
Yep.
And at the same time, I'm going to share my screen and show you a little bit of the website just for a few minutes. And this will be the only time today when we share any screen or slides. Okay, well, Julia, is this screen share working? Great, so welcome to SCANR. As you see, SCANR is part of the ANH Academy website. So if you look at the very top bar here, we have the tabs about ANH Academy. You've probably been on this website already since you registered for this conference. And you can learn there about the Academy Week and the working groups and other aspects of ANH Academy. There's parts of this website that tell you about the ANH Academy community and collaboration, and then parts about the Amana project, which I'm sure you'll hear a lot more about this week. But in this session, we want to focus on SCANR, which is our Synthesis Center for Agriculture and Nutrition Research. So again, we're hoping this site can connect researchers to resources and tips related to synthesizing existing data that's related to agriculture, nutrition, and health, the field that we're all working in. And you'll see we have an About Us page that tells you a little bit about this team at Tufts that's worked to develop this portion of the website, and also a little background about SCANR. We have some frequently asked questions about this web tool, but really the meat of this site is in the research guidance and use cases section. So in the research guidance pages, we walk you through each stage in the research process and try to provide key resources and some tips at each stage. So on the left side of the page, you can see menus, everything from finding data. So here in this finding data section, for example, we have a list of publicly available data repositories that are related to ANH, and a little information about each of these data repositories. And if you scroll through the data repositories, you'll probably immediately see that some of the ones you use might be missing. So we'd be really interested to hear if there are key data sets that you think are really important in this field that maybe are not mentioned on this page. Then we also go into how to identify the questions and methods once you have a data set, how to manage and analyze data. So these pages really focus on how to use statistical software to clean and prepare data sets and merge data sets and do data analysis. And you'll see that we link to different resources. And we also, on a lot of these pages, try to provide some tips for some key parts of using existing data that, many of you may know about, but some of you may not. So we describe things like, what is metadata? What is a code book? We want to make sure we hit on some of these key areas. And then we also have some resources about how to communicate results from data syntheses. So there's a lot of information in the research guidance pages. And as we're talking, feel free to open up another tab and peruse through the website on your own. And I also want to point out that we have a page of use cases, and these use cases are kind of examples for how the SCANR tool could be used for your own research syntheses and to answer your own research questions. So that was a really, really brief introduction. But as we said, one of the big things we want to do with this session is we want you all to go into the website, peruse, find new resources, think about things that are not there yet. So in a few minutes, we're going to go into our second breakout session, and you'll be back with the same group that you were with before. But this time, we want you to look through the SCANR site together, and we want you to really be critical and think about how you would use it and what it's not doing so well yet. So we want each of you to look through and find a useful resource that's new to you, something on there that you actually think you might use in your research that you didn't know about before. And then also find something that is confusing or missing or poorly explained, and talk about it in your group and kind of come up with a list of what is really useful and what is not so well portrayed or explained in this web tool. And so again, I encourage you to, in your group, designate a note taker so that when we come back, we can share again in the Zoom chat box what you've been talking about. And if we have time, we'll give a few groups the opportunity to report back out loud, because we do want to hear everyone's voices, even though there are a lot of people in this room. Anyone who kept notes for your group or who just has thoughts, to go ahead and start sharing in the chat box. Since we have so many groups, we're not going to have time for every group to talk out loud. So start sharing some of what you were talking about. And the first thing I hear, which I heard in a few groups, is that there's a lot of databases in that data repository section, and it would be great to have filters by things like country or type of data or focus area. I also see some of the databases are not free or not fully established. So that's a really good key point. We tried to focus this on publicly available free data sets, but you're correct that some of them are not fully available online. So that's a great point to note. Oh, we have some great suggestions here of new data sets. to add. So I think one thing that I'd like to do, we're going to take a break in a few minutes and then do our final breakout room. But if there is a group that would like to report back out loud and tell us a little bit about what your group was thinking, maybe you can raise your hand if you would want to report back. All right, Zach, do you want to report back from your group? You can go ahead and unmute yourself.
Okay, thanks. Yeah, I couldn't find the raise hand function, so I was hoping someone you could just see me do it. Yeah, we had a really nice discussion. We, just as everyone said, we really liked that big list of data resources available, and we thought the use cases were really helpful in giving us a good idea how to construct variables or do some basically more advanced analysis. Things that we thought that could be improved. We talked about how there was mention of in vivo kind of randomly in the data analysis software, but we weren't sure how that connected back to either the goal of SCANR or whether qualitative data would be within a focus of SCANR. And then we also talked about adding more cross-cutting themes than just gender and climate, and then maybe how those specifically relate to the to agriculture, nutrition, and health. Some of the folks in our group were also going to use those cross-cutting themes as a framework to merge different data sources. So maybe climate change with an agriculture, nutrition, or health data set. So guidance on how to merge those different data sources together. And then we also talked about, there's the guidance on if there's missing data, to contact the data owner, to contact the statistical agency, but that feels like a big leap to do kind of like on my own. So some ideas on what you should be asking people, what roles you should be, or the people within those roles who you should be emailing, and what you should be saying to them would be really helpful.
Thanks, Zach. That's really useful. I heard a few other groups also talking about qualitative data. Did anyone have reflections on sharing and using qualitative data? It's something we haven't delved into much. It's definitely a difficult topic to share qualitative data. It's difficult to share quantitative data without sharing people's personal information, and it's very difficult to share qualitative data. Okay, I think before we go into our last section, we're going to take a quick stretch break because you've been sitting with us for about an hour. So we're going to give you about 5 minutes to just get up, take a stretch, take a walk around, and then at about 4 or 5 minutes past the hour, we'll start up again. Okay, I think we want to start welcoming everyone back. I hope you stood up, got some coffee, got started your evening if it's evening for you. All right, welcome back to the main room, everyone. I hope the last breakout session went well. I already see that Doris has shared an interesting example of using health records from renal patients to do some of their own research. So I would encourage, again, each group to share in the chat some of the uses that you discussed in your group and some of the kind of difficulties and successes that you discussed. And, our goal with this breakout room is really to think about what are all the possible uses for a tool like SCANR, and what are some of the many different ways that people use existing data. And you may have seen on our website, we already have a few quote unquote use cases, which are examples of how the tool could be used. And we want to think about the ways that you all have used existing data in the past so that we can build out some of these theoretical use cases for future users. So I see some great kind of detailed feedback in the chat. Could I ask one or two groups to raise your hand or just unmute yourself and tell us a little bit about what you discussed?
I would add that we switch the default to be unmuted so that people can just start talking. We're actually 69 people and Zoom's audio controls are pretty good. So the background noise should be limited. You can just start talking. If you have a dog or child in the background or an ambulance behind you or loud traffic, it will pick that up. So you would mute yourself then. And many people do prefer typing. That's
spectators if they live in Japan and with restrictions.
So we will mute you if you're not actually talking, if it's just a sound. And I really appreciate all the people typing in the chat box. Remember, our goal is to get these generic use cases, these examples of a question or a topic, a theme, a set of data, and an aha moment, a discovery, some kind of insight that you were able to have from assembling different public use data sets to answer a question you had.
Perhaps I can jump in. This is Nilupa Gunaratnam from representing group number 9, and we had variable experiences and a lot of inexperience, including in my case of large data sets that are not our own. But there's some in the chat, but I guess some of the things that came up were issues of data quality and reliability in certain data sets, that there were some that seemed quite robust and reliable, others that even with our personal experiences, comparing the data set to actual in-country experiences, that there were discrepancies that caused some data to be suspect. So there's that issue. Data sets that might require further cleaning, and either have bad data and so on, or maybe more broadly having different uses in mind when they were collected, and therefore really being able to benefit from having good metadata, good description of sampling and other kinds of things, so that we could understand what's possible and what the limitations are. We had kind of a request to you all. I'm sure you get many of these, but one of them was kind of having more training and more guidance, or maybe more resources on issues of merging data, kind of developing a conceptual understanding when we can't merge at an individual level. What are these issues of data analysis in considerations that we should have, what inference you can do and can't do when that happens. There's a lot of subtleties there. And so any resources that were available are definitely welcome. Thanks.
Excellent. Yes, thank you, Nilupa. So some great points there about having data that was collected for other reasons. Often it's not what it seems. You do have to read the metadata carefully, the description of the data, try to understand who collected it, from whom, in what way, and then do that check that Nilupa mentioned. Does it confirm, or does it seem to be invalid for some reason? Does it check out? Does it make sense? Does it seem reasonable? Sometimes observations are surprising and true, but often when something violates an expectation, it's because there was an error somewhere. So you can do a lot of data cleaning before your analysis. Another great point that Nilupa raised is the importance and the opportunity to merge. And remember, you can merge anytime you have a common field, a common variable, whether it's a country to get the same data for that country, a subnational region like a state or district, and of course household can be merged and individual data could be merged. Other people want to share verbally in addition to the chat box. So everything from the chat box we will be gathering together and putting together additional use cases for the website. So every one of you has an example, a story to tell. So please do share that with us now so that we can make sure that the stories we tell, the use cases on the website, do reflect your experience. And after this session, if you have other ideas, definitely email to Elena, to Hyomin, and to me, or just to the address scanner. Scanner.
Edu.
Yeah, thank you. And we'll make sure that the use cases, as well as the rest of the SCANR site, reflects your experience.
Mm-hmm. And if anyone is interested in sharing a use case that's really specific to what you've done, we can work closely with one of you and, of course, attribute this to you on the website. What some of the other key challenges I see coming out in the chat box are that there can be very limited data availability, especially if you're interested in a specific country or region. I see Damaris wrote about sometimes data is not region specific. Sometimes it's not available in English, or on the other hand, sometimes it's not available in whatever language you are using and understand the best. That can be a really difficult thing to navigate. And as we know, we have a lot of data collected in certain regions and countries and not so much in other regions and countries. So it's not always something that we can change about the data that exists already. Is there any other group that would like to share some of what you discussed, or a specific example?
I could share from Break Room 4, just one example.
Sure.
An example coming from Uganda was that because for that particular organization, their main programming is dependent on the Uganda DHS, so that is, they use that as their main reference for nutrition and health survey. It so happened that because by nature the DHS is compiled every 4 to 5 years. In some cases, it was unable to sort of reflect current data when there was an influx of refugees into the country in a particular year that sort of had a change in the nutrition landscape in that particular year. And so anybody looking for data regarding nutrition in that year was only able to find what could be regarded as not so up-to-date or maybe outdated data for those reasons. So we just discussed the nature of the DHS and how sometimes the data could be obsolete in that sense.
Yeah, that's a really interesting point, that if you're interested in a very specific time period, like a very recent time period, or if you're interested in a very specific geographic area, you may have to consider that data that's representative at the national level may not tell you what you want to know about a specific area. I saw that Julia was trying to cut in as well. Would you like to share?
Yes, sorry. Yes. So I was actually, it's exactly the same data set in Uganda, DHS. And in our group, we spoke about also how the data, for example, in the DHS, the collection of data is really standardized for all the country. And this means that we are really missing sometimes some more specific and contextualized data. And we were talking about the empowerment score, like the collection of data on women empowerment. So yeah, I think this is really something that is missing, really contextualize the question in the country where they are collected. And also another thing that I didn't discuss, but I was just thinking now, and is related to what you said before as well about more geographical location. So in my case, that I'm working with indigenous population in this national, international data set, you don't find anything about indigenous communities. So it's really like for minority, it's impossible to find. I mean, it's not maybe impossible, but it's really rare that you find data on nutrition and on agriculture. So for example, the DHS of Uganda exclude completely the area where I'm working in Uganda, that is with this indigenous community. So I don't have any kind of data. So I cannot compare my field work with secondary data. Thanks.
Yeah, that's a really key point, that some of these very powerful data sets are really representing more of an average across a country rather than specific groups that we're interested in. Did I hear someone else just trying to cut in?
Yes.
Go ahead.
Okay, yeah, from group 6. Yeah, in addition to what we have all said, I'm Ademika, and I'm representing group 6, where we found that it's very important for standardization of tools for us to be able to use secondary data effectively, especially when you're working with multiple region or across country. Additionally, we found that using secondary data also gives opportunity for multidisciplinarity. You know, it's when you have working in a team, you know, it brings together a number of researchers. For me in particular, when I had the opportunity to work with secondary data, I'm not a statistician, you know, not very deep. I could do the preliminary statistics, you know, but when you go into the deep statistics, you know, it was very good that we had a good statistician and biostatistician on the team. And I see that it's the secondary data facilitates this a lot, especially when we advocate for multidisciplinarity in research in Nigeria and globally as well. So that's one of my contributions that came out from our group.
Yeah, it sounds like you're a loyal member of the ANH Academy who's really invested in work across disciplines, and I think we all agree. I'm also hearing a little bit of the kind of tension between collecting data that's comparable and standardized across countries so that we can compare directly. I heard Julia mention the Women's Empowerment in Agriculture Index, and having a standardized tool like that can help you compare levels of empowerment across countries. But at the same time, if you're using the same questions in every country, you really are missing out on some of the subtleties and the aspects of complicated topics that will really differ between countries. Now let's see, I think I heard one more person trying to jump in a few minutes ago.
Yeah, hello, I'm also from Ademika's group, but I was going to say something that in terms of data being specific or not, Shahid in my group, he said something that I found really interesting. He was trying to work on daily dietary intake, but he used the FAOstat data, but it was really an average, and they had pulled data from adults and children together. So there was really no way to separate them, and children would obviously consume less than adults, but it was just a figure, and there was really no way to separate that. And I found that really interesting in terms of having pooled data.
That's very interesting. Yeah, sometimes the way the data is arranged and cleaned in advance doesn't fit with what you're hoping to look at. Michael, I keep seeing you unmute yourself.
Yeah, I think I'm waiting for my turn.
Go ahead.
Okay, what we discussed in a group was the problem of reliability of sources. We looked at instances of national data and data from global organizations like World Bank. You might be looking at hunger indices, in fact, in Nigeria, and Nigeria may be reporting a figure, the World Bank is reporting another figure. So the question is, which of the sources is more correct? Is it the national or the global? So that's a problem. We looked at the possibility of getting the right data from different sources when those sources are reporting different values.
That's so important and interesting. I want to just comment quickly on that, where you would find different numbers for the same thing. So of course, sometimes that's actually because the definitions are slightly different. So we sometimes have the same word in English for things for which there's different definitions. A classic example is national income. There are many, many ways to add up the total production or total buying power of all of the people of a country. And so in the World Bank data on GDP or GNI or some other type of national income, there's many different definitions. But also, Michael, you know, as everyone has experienced, you ask the same question of the same person on 2 different occasions, you'll get a different answer. And that's because the situation has actually changed a little bit, or it's diverse. And then there's, of course, lots and lots of measurement error. So one of the things that we're learning here is just tremendous humility. Humility about thinking that we know more than we really do, because the more we discover, the more data we get, the more contradictions of the type that Michael described we encounter. And so we need to sort them out. Are they different definitions? Are they different answers because things have changed? Or are they measurement error? And there's a whole lot of measurement error. There's a whole lot of change and variation. And there's a whole lot of different definitions, sometimes for the same word, a slightly different version of it.
Yes. Okay, we have a few minutes left if anyone else wanted to jump in. We have so many interesting comments in the chat box. And as you all think about that, I'm going to, as Will said, we're kind of thinking about how to better build out this web resource so that it can be as useful as possible to other members of the ANH Academy and to all of your colleagues. And so we really do invite your feedback and your thoughts. And we're also really hoping to build out our set of use cases, examples of how this can be used. So we would also invite you to kind of share your thoughts on that. So I'm going to put our contact information in the chat box. So feel free to reach out to us after this session, and we'll also be around for the rest of the conference week. So we hope we'll see you in some of the other sessions and in some of the social sessions where we'll have a little more time to chat. And finally, we have a follow-up survey. It's really short. It will take you less than 2 minutes, but I'm going to drop the link in the chat to this brief Qualtrics survey. We'd love to hear a little bit about what you thought about this session. Feel free to be honest, and we hope that you really enjoyed this. We hope that you met some other people who will be attending the rest of this conference for the next few weeks, so that when you're in other sessions, we'll see some familiar faces, and we hope that you learned something. And I think Will and I definitely learned something.
Yes, indeed. So a lot of insights. Thank you so much for what you've typed, what you've shared with each other in the breakouts, what you've said out loud in this group. I hope you feel, as I do, that a principal goal of the ANH Academy is to have a community, to feel like we're in this together, like we can learn from each other, like everyone has something to share. Everyone has a unique perspective, and we're able to gather it together. I hope that you find this particular resource, SCANR, that Elena and others have put so much effort and time into. We've had lots of feedback already, but it's definitely changing, and it will change thanks to you. So really appreciate all your feedback and input to build this little community around SCANR, the larger community around ANH Academy, and then what we can contribute to our countries in terms of improving the agriculture, nutrition, health outcomes in the areas where we work. So thanks very much.